Welcome to another exciting episode of MedLife Scoops, where we delve into the minds of healthcare's most innovative leaders, uncovering the stories behind their groundbreaking work. I'm your host, Dr. Priyanka Mathur, a medical doctor and entrepreneur behind MediPocket USA and Surrogacy USA companies innovating in cross-border care and family building. Today, we delve into healthcare innovation with our guest from Saudi Arabia, a distinguished figure whose expertise bridges the realms of informatics, artificial intelligence, and healthcare innovation. With a PhD in informatics, he embodies a pinnacle of knowledge in computer science, data science, digital twin technology, and software engineering. His career is marked by significant contributions to software development projects and cutting-edge research that pushes the boundaries of what's possible in healthcare technology. We welcome Dr. Ismaeel Almakrami to MedLife Scoops. Dr. Ismaeel, welcome to the show, and it's an honor to have a healthcare visionary and thought leader like you with us today. Welcome you to the show.
Thank you so much, Dr. Priyanka. It's my pleasure to be, I think, the first Saudi guest in your podcast. And really, it's my honor to know you as a person and also to be your guest in your international podcast.
Dr. Ismaeel, your path to becoming a leader in healthcare innovation is not only remarkable, but full of unique insights and experience that have molded you into the trailblazer we see today. So our listeners are keen to discover the stories behind your success, the one that show the richness and variety of your journey. So could you please share with us 3 lesser known aspects of your experience that have significantly influenced your perspective and approach in healthcare innovation?
Yeah, for sure. Yeah, we used to talk about our big milestones of success, but as I told you, as a smart introducer, you ask about something different about my lesson known, let's say, success stories. For sure, as any guy who believes on the importance and how the promised future of technology, that's in one hand. On the other hand, I also believe the importance of providing a high quality healthcare services. So I remember, let's say more than 20 years ago, I remember my first meeting when I just started my, what you call here in Saudi Arabia, internship as a student at the last year of our degree studies. We should practice for 1 year. And I remember at that day, when I met around 12 experts, they were sitting around a long table, and when I just walking, going forward to these guys, I was really smiling. They say, when I sit, they say, Mr. Almakrami, why you are smiling? I said, I'm sorry, I'm not sure. Are you waiting me? All of you are waiting me? Or maybe you were with somebody and I just came, something like that. I couldn't understand at that time all these experts and well-known names in King Faisal Hospital. It's one of the well-known also names of healthcare providers in the Middle East. I couldn't believe these people are waiting for me as intern, or they say, yes, we'd like to introduce you and we'd like to delve into your passion and understand what you believe to, or why you would like to have your training here in this hospital. And I remember one of these questions which was inspired me. Honestly, it started from me, but really I just keep it all during all my journey. They asked me why you would like to work on MRI. I told them for one reason. I believe MRI I could practice 2 things. I love it: healthcare providing and also technology. I remember that day, later the MRI supervisor, she told me, Ismaeel, because this answer we accept you. I spent more than 1 year at that hospital, and to be honest, since that moment I still every day remember this answer, and up to this moment, I still believe the importance of technology on healthcare services. So I just summarize the whole less known experience, if I can say it, in this world, the importance of technology in healthcare services. So from then till now, till tomorrow, I still believe how technology could reshape the healthcare delivery for us, for our parents, for our kids, and so on.
That is actually a very unique and inspiring answer. I think I bet all these 12, very big leaders, they were like surprised to get that answer from an intern, and very beautifully put. Like, healthcare is not, when we talk about healthcare innovation, it's not just the medical aspect of it. The technology integration beautifully with the understanding of it is so important. You're from Saudi Arabia. You're in Saudi Arabia, and your path to healthcare innovation is compelling. Could you share an early experience that exposed healthcare gaps back home or in Saudi Arabia and sparked your drive for innovation? We are curious about the catalyst that set you on the impactful healthcare journey.
Yes, for sure. I think Saudi Arabia as a nation like others, even nations or countries or whoever who would like to provide a high quality healthcare services. So the journey, it was not just for me, the whole journey of digital transformation, it goes through plenty of obstacles and challenge. Let's say challenge. It's really challenge because we used to overcome all these challenges by time. Yeah, I remember. Also, I'll go back. I have a good loyalty to my history, especially tonight. Really, you let me just remember. Yeah, most of the back doors. Yes, I remember when I applied to get my scholarship, I got a degree in radiology sciences. But at that time, we got a great chance from the Saudi government to have scholarship to study in some countries such as US or UK or Canada or Australia or all these high quality education universities. So at that time, I was thinking to get my master's degree on MRI, for example, or some specific radiology. I remember when I met some expert in some conference in Jeddah, Saudi Arabia. Then we just discussed. I told him, Doctor, I'm thinking to get a master's degree from US or UK in MRI. At that time, he said, okay, that's great to be a good expert in this field. But why you don't go just read about something called health informatics? I remember that night. It was a night. Jeddah, it's beside the sea. And I remember all the night, I was just thinking and just using my Nokia mobile, trying to search for about this new term, health informatics. And I remember at that time how this field, as much as I read about it, as much I believe, oh, that's mine. Yeah, that's the area I would like to be in. After that, I found some areas, some gaps. I understood at that time health informatics as a field, as a degree, it comes from a gap between IT professionals and healthcare providers or professionals as well. Healthcare providers couldn't understand IT staff and IT people. IT people as well, by the same way, they couldn't understand health professional needs. And from this gap, they believe we need to have this joint called health informaticians. So one of the main challenges, it was the language between both healthcare professionals and also IT staff. That was not just in Saudi Arabia. I believe it was even at the country I was studying in, the UK. I remember the first assignment they asked us, it was about, do you think health informaticians should be, or health informatics should be dealt as a a new profession, or no, it should be related to medicine or related to IT studies. It was also in the UK and US, I think it was still at the first decade or second decade. So that it was a challenge. The other challenge is the resistance, end user resistance. I remember, and it was also my master study. It was about how end user acceptance towards health informatics systems. So the end user resistance, it was so high, not just here. I believe more than 70% of health informatics projects fail. When we say fail, it means maybe it's over budget, over time, or even it doesn't get its pre-defined goals. Why? Because one of the main reasons of this fail is the end user resistance. Unless you aware these people how this health information systems would help them to get their result, to improve their productivity, to reduce time wasting, all these stuff, they will not accept it as anything in our life. Unless you and me, we believe how the mobile phones in our hands, it does make our lives better and easier, we will not accept it. Absolutely, we throw it away. It doesn't mean to just keep your pockets always filled with this strange stuff. So this is another challenge. And for that reason, I believe how what's called change management is so important, not just in health informaticians or health informatics projects. No. Even any change projects should be associated with change management, professional change management. Unless this go through beside the project itself, believe me, the risk of fail would be higher than other. The third challenge also we still, and to be honest, up to this moment, we're still trying to resolve it, but I'm sure we are gonna overcome it, is the compatibility between different systems, vendors. As you know, it's a market, it's a huge market. Plenty of vendors, names, systems, and as you know, some vendors used to do some tricks. They don't like other vendors to come on there. They would like would you like you as a hospital owner or to just buy from them, and they restrict the compatibility with other vendors, all these stuff. So it was honest, let's say 5-10 years ago, it was a big challenge. Today it's better, there are plenty of solutions, but we still, as much as we go forward, as much as we will face more challenge, but we are so empowered, so powerful with our passion and our belief on the technology and ourselves as well.
That's so always, learning to hear, how each nation is handling their own gaps, plus the gaps that is global. And something new that we learned that you educated us is on this health informatics. It's really a gap or a bridge for this fulfilling this gap between the healthcare providers and the engineers, because both of they talk two different languages, and you're right, it's hard to communicate with each other in a very
absolutely
understandable tone.
Absolutely, totally different language. Absolutely.
Yeah, and healthcare people get very intimidated. The healthcare professionals, when it called the doctors and nurses, particularly more on the clinical side, they get intimidated when you use very heavy technical language because they're not designed that way. So.
For sure, that's a language I couldn't understand. Nobody would like to speak with them with something you can't understand. Absolutely. By the same way, the IT staff, when you talk with them about some codes and terminology, medical terminologies and all this stuff, it's not my job. It's not my job to understand what's the kidney, renal, or what's called for the liver. And no, it's not my job. I used to just work between codes and all this stuff, technical stuff. So, yeah.
Really interesting, people think healthcare system is just about treating people or treating patients, but it's a lot that goes within the whole ecosystem. There's so many pillars, or the pillars that have to be connected well together so they can have a good foundation to build the healthcare system, which is treating people. But there's so many foundation elements to it. And I think it's also one important thing I would always like to, I believe and like to say is that it is important to have healthcare professionals, healthcare leaders with a good knowledge of technology, because if you
Absolutely.
don't understand something, it is hard to use, as you're saying, end user issue, right? It's hard to use. So get involved a little bit, start learning. You don't have to be masters in that, but at least have a little
Absolutely.
familiarity to it. So amazing.
Absolutely. And I agree absolutely with you regarding that. I guess also there are plenty of countries, they believe the importance of having someone on the top of the authority to have some, at least, as you said, basic line of technology.
Technology is advancing with such a fast pace that it's at a speed that it's sometimes hard to keep up with that if you're not really in that. But as you rightly said, having some knowledge of it, it always helps to use that. You might not have to create it or innovate in that, but you to use also to have that. With that technology question and your expertise in it, we would like to touch on this digital twin technology. We would like to ask you if you can explain what actually it is, and how do you envision the future of healthcare, particularly with the integration of digital twin technology?
Yes, I think it's one of the promised initiatives of healthcare, which we should see it as soon as possible. I believe on that. It's just, let's make it simple for the listeners, and to make it, it's just some kind of simulations. How could I expect this situation will be before it happened real? That's it. So as much as you can, as much you can know, as you know, in technology, one of the main challenge is the timing, when you should have the right decision according to the right evidences. As much as you can get it earlier, as much as you will get a good decision towards healthcare services. So digital twinning, it means you just imagine, it's not just imagining, but I would like to make it easier for people. It's some kind of simulation. What will happen for this patient if he do this or not that? What will happen for this technology if we apply it in our, for example, institution? What will happen before we spent our money, before we spent our time, before we make this patient under huge risk or something like that. So I believe it has a so promised future. And to be honest, I'm still, it's a questionable for me why this so promised technology up to now, it doesn't deployed or spread out as it should be. There are plenty of technologies everywhere, but I guess it's still underestimated from the healthcare decision makers, and that should be highlighted by somebody from me and you and all these people who believe on that technology. So I guess it will see the right soon.
And I think when you really simplified this word digital twin as a simulation, which it is, and again, the thing that you have pointed early and again here, why some technologies takes time to get adopted, it is actually comes the resistance more from the user, which in our case would be the healthcare providers, and the decision makers, which are these regulatory bodies. In US we have HIPAA, and the issue comes back to the point they do not understand. We do not understand technology and that's why we don't know the benefits of it. We cannot envision what the benefits. As a technical person, with a good technical knowledge, you can envision the importance, or you can see what it can do, the benefits of it. But again, for us, it's like another piece of technology you're putting.
Absolutely.
So the knowledge awareness to technology is important. I mean, again, we say that to the patients, and agree with me that we say to our patients, understand your disease. It's not you treat your disease, but understand understand your healthcare needs your own. We want you to be involved in your own healthcare journey, right? Not be a bystander. Okay, whatever the doctor will do, I'll do it.
For sure. I think it's a fight between awareness and resistance. As much as people, even these people, patient, end users, decision makers, as much as these people, their awareness become more and more and more, as much as their resistance will be low and low and low, and vice versa. More resistance, it means low awareness about how these technologies would help us, would make our life easier, would make our relatives' lives easier, and all this stuff.
Important point that you said, awareness and resistance. Beautifully put. As we talked about, this technology, digital twin, artificial intelligence. So, how do you see that with your work in artificial intelligence and data science, bridging the gap between traditional healthcare practices and the digital future in Saudi Arabia?
As much as you would like me to talk about Saudi Arabia, but really, I believe it's a common issues. I will make it wider to the global, because I believe we are sharing the same interest and we are sharing the same benefits, and these technologies will provide a lot for all of us, not just Saudis, all of us. Honest, I don't know if it's fair enough. I can say there is no comparison between both. Really, the traditional, okay, we believe how that the traditional way of healthcare delivery, it does help us, help our grandmoms, grandfathers, and all these, and our parents as well. And maybe, I don't know if we still in between. But I believe also how artificial intelligence will make the difference. Absolutely. I guess someday, Dr. Priyanka, someday after let's say a decade, is it? Maybe less than that. But anyway, let's say a decade. And if you remember me, you will just ask me to be another time a guest in your multi-international podcast, and you will ask me, Ismaeel, let's just talk about how healthcare or artificial intelligence does make the difference. I believe absolutely artificial intelligence in different ways. I couldn't honestly talk about specific, but let's say it's the best practices of people. Just let's also simplify it for people. When you remember, there are some computer. It's more than a computer, honest. It's a plenty and plenty and plenty and plenty of computers working together as a brain to take the correct decision at the correct time based on inaccurate data. That's the difference. When we say now the doctor, for example, the traditional doctor, they just, according to some papers, I don't know how much you are a doctor. It's a secret of you as a doctor. I'm not sure how many lines you will read in your patient file. And according to that, I don't know how many images you will see, all these stuff. On your brain, which also mix with your family concern, your staff, your people, your social life, you're thinking about your tickets, your flights, your family, your kids, all this stuff. By the same brain, will just take the decision about your patient. Whereas in comparison, there are, as I said, millions of computers. At the same time, they have a cover the world. So every day we are hearing about the new diseases, the new technology, the new So yeah, that's just to make it easier for people. Artificial intelligence will make the difference. It will provide us the correct data at the correct time based on a correct information. I think that's these three, if I can say, corners of the decision triangle, what we are, or you are, or any healthcare provider need to make a correct decision.
You very well pointed out human limitations. Doctors are humans, and we do have limitations both physically and mentally, because we have so much as the role to play in our life as a human. And it's yes, we try to focus, we can switch off a lot of other things and focus and do it with our medical knowledge and all. But the advantage that the technology has, or this AI has, it's they don't have kids, they don't have partners, they have nothing to do. It just do one
Who knows?
task.
Maybe after the kid, they will get their families, and who knows?
Yeah, we actually don't know how this is gonna be turned out
Yeah,
when we get to the super AI, as we call it, right? That's
absolutely.
going to be a scary one. But that's so beautiful, beautifully put. And when you were talking about the diseases, to be honest, there's so many we know, but there are so many more than that we still don't know. Medical science still doesn't know. And recently, if you have heard the news from the royals, that King Charles have been diagnosed with an unknown cancer. Now, even such an advanced healthcare system of the world, which is UK, we have a cancer that's labeled as unknown cancer. So
Absolutely, absolutely. Let me just support your thoughts about. There are some application called clinical decision support. It's by some way. It's so. Let's say it's by some way some kind of artificial intelligence. Not that much, but because they're based on a limited database. But for example, I remember that when I was at the UK, I remember I was just wondering why every time I visited the doctor, he just asking me, and at the time he was just typing on his computer. I said I couldn't see his eyes. Why he doesn't talk to me face to face? I would like to see how his facial expression and like that. After a while, somebody explained that. He said, yeah, he's just using something called clinical decision support, CDD. And he would like to, he just insert your symptoms, your gender, your age, and all these stuff. At the end, the computer will suggest some diagnosis for this doctor. At this age, with these symptoms and these results of lab and this and that, the suggested diseases you can diagnose him by. One of these is A, B, C, D, like that. This is a simple way of artificial intelligence. The main difference between this and the real artificial intelligence, the real one, there is unlimited database. There is updated database in a daily basis. Not what you insert already inside this tank. No. It's open to the whole sources, to all university libraries, all studies, all these stuff, all experts, and it comes in a daily basis. So it does trustworthy more than the one I just used to fill it. I should update it from time to time. So yeah, and even that you can see how the clinical decision support, it does make a sense, honest. It make doctors' work is easier and more accurate than others who based on his mind.
We talk about it a lot that AI is actually not competing, or we are not competing with AI, to be honest, but it's actually augmenting us, as you shared your experience. It actually augments doctors in helping the decision making, because we can have the knowledge, experience to, let's say, 10,000 patients record, but AI can do it at the same time for millions around the world, and can draw the insights from them and analytics. Continue this. Now let's take you a little more back in time. As you know, I love histories, right? We'll take you again back in time.
Yeah, I'll go back to my old notes.
Yeah, in fact, can take you more further back, and we would like to ask, like, on a very imaginative question. So, if you had the chance to travel back in time and meet any inventor or healthcare pioneer, who would you choose and why? And what question would you ask him or her?
There is some person in my mind, and honestly, he inspired me a lot. And I think also for you, he does mean something. Mahatma Gandhi. I think if I have a chance to meet this guy, because honestly, he's totally different. than others. When I remember the photos I used to see for him, oh my gosh, who could believe he's so simple guy make the difference globally. Honest, some people like him so inspired for someone like me who used to delve to see what's in deeply. I don't like just to go through. You know him. If you look at him, you'll see who is. I will ask him just one question. Because honest, I believe on his speech and his. I'll ask him, are we in the correct way in healthcare, in terms of healthcare delivery? I know how he is so aware about. I like how he makes the balance between the tradition, lifestyle, and also the importance of science and get informed of data. And to be honest, I'll trust on his answer. Are we in the correct path, or we still have a chance to alter it somewhere? That's it.
Wow. You're actually very beautifully put because, definitely Mahatma Gandhi, he inspired millions around the world. But for Indians, I would say he actually instrumented a tool which is getting the freedom with peace. Like, you can still get the freedom without shedding even a drop of a blood. And that in the history of the world, when we talk about freedoms for anything or revolution, it's all about, has to be some kind of fights or some wars or things like that. And he just came with this idea which shook the world and shook India also. It's like, how would we do that? Now let's kind of take your vision to the future. And sorry, we are taking you from the past to the future, but that's the fun part is now when gazing into the future, your vision for confluence of technology in healthcare is incredibly important. So what is your greatest aspiration for how these fields will merge, and how do you see your contributions evolving over the next decade in healthcare, not only for Saudi Arabia? As you said, the problem is global, a lot of healthcare problems are global. So how do you see your contribution evolving in the next decade?
Yeah, I can use 2 or 3 words. I'll say, as much as I can contribute in data flow. When we say data flow, it means data sharing to the right people at the right time. And also, I wish some question like that I was asked a couple of weeks ago here in my home city in some hospital. They asked me, Doctor, what do you think? How is the healthcare delivery will be after 10 years? I think someday we will laugh about what we're having today. Because honest, as much as we believe our, let's say, healthcare delivery now, it's easier than before. But even that, there are plenty of obstacles, honest. Even that, we still should have our, for example, laptops or our mobiles, and choose the correct app to go to the correct hospital, to make the correct appointment. If everything does work well, networking and all this stuff. And choose the day, choose the time, and after that, waiting for the response comes from the hospital in a text message or something similar, or email. Now we believe, oh wow, that's great. Oh my gosh, oh my grandmom, oh, they spent a couple of days just to go to the hospital, and all this is how their life was so hard. I guess during the next, let's say, 10 years, especially here in Saudi Arabia, because I think we are doing a great job now. It's not just now. We started a couple of years ago, but really I think we are putting our feet on a solid ground. I would like to see how the Internet of Things would work together. For example, when Dr. Ismail have a wearable device checking my pulse, and in some point, this device will send a sign to the ambulance center. There is something abnormal. And according to that signal, the ambulance will get my location according from this wearable device, and they will get to my home to get me. And during the road, all traffic lights will be green according to the signals come from the ambulance itself. And the hospital will be informed before the ambulance moved. Dr. Ismail is coming to you, prepare everything, ask the doctor to come, just wait him. He needs 7 minutes, 8 minutes, 9 minutes. I believe at that time, and some text message will go to my relatives, tell them about what happened for me, and you will find him in this hospital. Don't worry, we will keep in touch with you. I believe as much as there are plenty of chances to make our lives, to make our healthcare services better and easier without our interaction as a people. We'd like everything works and talks to each other simultaneously and smoothly. To be sure, you can check on your kid or your mom or your dad just through your mobile. No need to call him every day or to call her nurse or to call her, how's mom, how's the okay, did she get her medicine, did she okay, how's her medicine? No. In some day, I believe that will not be so far. Inshallah, all these dreams will be real. And from that point, inshallah, we will think about a new dreams, which will be real and real and real.
You just gave a script to a Hollywood movie, you know that, right? So if this podcast goes to
this time, it's after 10 p.m. Saudi Arabia, so it's just for imagination.
Yeah, no, that's what I'm saying. I mean, if any of these directors fall onto this podcast, these Hollywood directors, they are going to pick on this script, because what you just created, the whole, this automatic informing, triaging and getting it's really something, as you're saying, that's where we want it to be highly automated, intelligent system, right? Where it's really not involving physical attention, where I need to press this button in order to inform, and like that, seamlessly happening.
Absolutely.
And another thing,
I think it's achievable, honest. And as much as you can, let's say, make a language or interact AI with Internet of Things, with some wearable devices, and have smart cities, and that's it. All these machines will talk to each other. No need for your interaction. Just everything will come automatically. Everything will be. Yeah, I believe that will be, inshallah, soon. It will not have. It shouldn't. We shouldn't stay for decades or something like. No. I believe it's coming. Even in your country, US, or maybe we can do it instead if you will do it in Saudi Arabia.
Saudi do big things, and it surprises the world in many ways. So we never know if that's coming from Saudi first, but we know Saudi Arabia has inspired and shown the world. Now, as we're talking about all this, the futuristic thing, I would like to talk about superpower. So again, let's go into imagination. I know it's a night on your side. Let's do that again.
Let's fly. Keep up the clouds. Yeah, okay. I'm still there.
So
okay.
Let's hold on to them. And we are saying, let's think you get a superpower, right? And a superpower to transform healthcare in Saudi Arabia. Let's talk it about your country only. If there's a superpower that you can get to transform healthcare in Saudi Arabia, what would be that superpower and why?
Let me start by why first, and then I'll tell you what's that. Why? Because I think we spent a lot of money in the wrong direction. I'm talking about 50, 60 years ago till the last, let's say, 10, 15 years, 10 years ago. So during this 5 decades, we spent a huge amount of money. We spent a lot of aids, efforts as well, which I believe we can reuse it. If I have a superpower, I can reuse all these resources on the correct way, on the way which based on evidence, on the way which believe on technology, and on the way we focus on the preventive healthcare more than treatment healthcare, which is now, it's one of the big challenges for Saudi healthcare services or system. For example, let's just imagine, for example, in my home city, we still owe the budget of the preventive care less than 13%, whereas the inpatient percentage of the budget is around 60, something like that. That's just to reflect how we concentrate on the treatment more than the preventive. No, if I increase the awareness of people, if I, as a decision maker or someone who has authority, if I empower people to avoid getting sick, to avoid getting disease as much as we can, no, I can't spend, I can't use this money and these different resources in something else. So I guess I'm happy about what we are now, but I believe because we got a great chance 5 decades ago, I believe if I'm having this superpower, I'll reshape the healthcare system since 5 decades. And hopefully today will be real above the clouds.
You very rightly said, obviously, I asked you to focus it on Saudi Arabia, and you beautifully have put, but to be honest, globally, it is the thing that most countries around the world, the countries that could do, had the resources to make those things, focused on the different direction. Healthcare was only focused in a way, okay, you get sick, we have the advanced machines, we have the advanced technology, we are putting money on the clinical trials, we'll treat you when you get sick. But what about, we do not want to get you sick? Preventative care, right? So from the sick care model, and I think a lot of healthcare leaders are now putting awareness out about this preventative care, that our system is not just the sick care, but also preventative care is a part of a care system. It's not if the patient are not coming to the hospital, they are not part of the healthcare system.
For sure.
The care.
No. For example, here in Saudi Arabia, we have something called the new model of care. This model of care, it real starts from home, school, mosque, for Muslims, as you know, here in Saudi Arabia, and so on. So it starts from your home, how you should live at home, how you should eat at home, and then restaurants. Every restaurant should provide a list of calories, should inform their customers about the disease of this, for example, this meal, what it does contain of, and all these stuff. So like that, to increase the awareness. Okay, you are gonna eat this donut, it looks small and so delicious, but you will get 1,000 calories. Okay, just to know. Okay, so I think as we keep in this way, even at the mosque, the imam will talk about all the stuff like that to increase the awareness of healthcare, preventive care first, and so on, school as well, and then if you get sick, after all these, let's say, shields, if you get sick, which is, that's normal to get sick, but at least you protected yourself from plenty of, not like what happened in couple of, let's say, I think in different countries. The child used to eat every day plenty of Nutella spoons and all this creamy cheese and all this stuff. Nobody care. When he cry, just give him some cola or give him some chips. And also at the school, you don't care about what they are eating, what they are doing at their school. Even when they get out picnic with their kids, nobody care. Okay, alhamdulillah, he's fine, he's fine. Okay, when he get, oh, he has a fever, okay, I'll take him to the hospital. That shouldn't be. And now I think in Saudi Arabia, with this new model of care, will make the difference.
It definitely looks promising, and the new model of care starts from the home, takes all the things into account. So family, education, which the schools, universities, and I like that about the restaurants. Now, that's actually a new angle that you talked about, the restaurant. Yes, a lot of restaurants do provide the calories, but it's not mandatory to provide. But I think doing that as a part of the care system that is imposed for restaurants to list that, I think it's another thing, because it's like conscious eating, right? As you rightly said, I know this donut has 100,000 calories and I still eat it. I'm consciously eating it, and I know as a healthy person, I need to burn those 1,000 calories. How I'm going to make those adjustments of treating myself this way. So conscious eating is definitely one part of the one. A new model care station, definitely we can keep going. There's so much to learn from you because of your vast wisdom and experience that you have. We are near the end of our conversation, and I would request you that could you impart some wisdom to a diverse audience of healthcare enthusiasts, from young visionaries to the seasoned skeptics, about the critical role of innovation in healthcare, and what advice would you offer to those aspiring to contribute to this field and helping them to navigate its complexities and make an impact on shaping a healthier future?
Tell them how this field is still looking for their efforts, still looking for their minds and their thoughts. Even you think, oh my gosh, now it's all high grades. Okay, I think, no. There are plenty of chances to build on the knowledge of healthcare or current healthcare. So that's first. The other thing, start from the point others end on. Technology today is one of the main factors of success for any healthcare system. You couldn't provide healthcare without technology. Technology itself, there are also, at the same time, implementing technology will not guarantee your success. As we mentioned a couple of minutes ago, it's an empower. It could increase the success possibilities. But unless you provide or you implement these technologies correctly, following the best practices and monitoring healthcare or these technologies implementation. So as much as you can make a balance, patient-centric services, as we discussed a couple of minutes ago as well, the patient, or shouldn't be a patient, the person himself, before he became patient. All services should start from this guy, from this lady, from this kid, from this mommy, from this daddy, it should start from them. How they eat, how they breathe, how they exercise, how their lifestyle, how they sleep, all these stuff together. Healthcare, it's not, as you say, it's not a medicine, it's not a bed, it's not an ambulance with a noisy sound. No. Healthcare, it's a lifestyle. As much as you take care of your health and your relatives as well, and you increase the awareness of healthcare best practices as much as we can overcome this phenomenon. So I would like just be patient, believe you are entering a so promising future field, and you will have a great journey with health and health informatics especially.
Healthcare is not just the healthcare, it's your lifestyle. Very, very well said. Dr. Ismaeel, it's been a privilege to have you share your insights on MedLife Scoops. Your commitment to healthcare innovation is a beacon for us all. And thank you for illuminating the path forward in global healthcare, from Saudi Arabia to the US and beyond. To our listeners, this episode is a reminder of the power of innovation to address healthcare challenges worldwide. Whether you are in Saudi Arabia, Dubai, India, Europe, or elsewhere, there's a role for you shaping a healthier future. Thank you again, Dr. Ismaeel, for inspiring us today. And to our audience, let's take this inspiration to heart and contribute to a global healthcare landscape.
Thank you so much for having me as a guest. I appreciate that. Hope to, if you find my thoughts attractive by some way, hope to see you again, even here or in Dubai or any other scientific conferences. It's my pleasure. I'm so honored again to know you, to be your guest. Thank you so much for you and for your whole team of MedLife Scoops.
To our valued listeners, you must be inspired by Dr. Ismaeel's journey. Dive deeper into healthcare's cutting-edge innovations by subscribing to MedLife Scoops. Join us to uncover more untold stories and be a force for change in crafting a healthier future. Thanks for listening. Keep exploring and keep innovating.